all. This is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. So I hope you liked the talk with Dr. Corey yesterday. Today, I wanted to actually do two topics. One is the one that we look into right now, and that is the Delta variant, the vaccination status in Israel and the vaccination status in UK in context of the Delta variant, because there is so much Twitter storms going on that vaccine efficacy has dropped. So the summary of this is, yes, vaccine efficacy for even fully vaccinated for infections has dropped. However, for hospitalization and for severe cases, the vaccine efficacy is the same as it was at the time of trial, or very similar, and I'll show you the numbers. The other thing that is interesting for me is that this data that the vaccine efficacy has dropped, and we actually have discussed this many times before, that because the variant is faster, it can create symptoms faster, even in the vaccinated people as well. So it's not a hugely unexpected thing, and it's also not a proof of vaccine failure or SARS-CoV-2 becoming something else. But both camps who do not want to have a vaccine and those who want to have a vaccine or promoting a vaccine, they both are using this for their own with their own interpretation on it. I don't want to call it a spin because it's really an interpretation. One group is saying this simply means that we should quickly vaccinate everyone so that they can join in with 100% protection. And they're also saying that, hey, look, the severe cases and hospitalization is not affected. The other group is saying, hey, the variants are they're escaping, as some of the experts had been saying before, so-called experts, in my opinion. And because of that, the variants are actually going to get out of the vaccines, and they're going to be soon out of our hands. I don't think that data shows these kind of things, and I don't think that there is a huge issue, at least in UK or Israel, and so that is the data I'm going to look at. I was going to do a separate topic after this discussion, and that is about the endothelial cells expressing spike protein, and that is the discussion you may have heard with Dr. Paul Marek on a phone call when I was discussing or talking with Dr. Corey yesterday. So that discussion continued with some of the folks afterwards in the emails, and I was surprised actually that there are some experts, once again, who do not actually understand the immune mechanisms. So maybe I take them for granted, that I think that these are fine and everybody knows them, including healthcare professionals, but it's not necessary that everybody knows them. So with this, I want to do the second topic as well instead of just a chit chat. Having said that, one final comment, and then we start looking at the data together. I had some acute condition, I was not feeling well, went to the doctor, he started me on a medicine that has caused a lot of nausea. That is a side effect of that medicine. So I have taken the medicine and I'm quite nauseated. So don't mind if if my expression changes every so often. And number two, if I'm not able to do the second part of the video. So with this, let's start. So back here, these are our gifts for humanity. We're going to continue talking about them. Important thing is today, I also, because I was a little nauseated, I did not have enough wherewithal to sit down and kind of draw all of this. So most of this at this time is in a PowerPoint. With this, before we talk about these things, here are the links that are in the description as well. This is Drbeen.com. This is Vaccination Tracker from the New York Times. All I have used from here is the amount people vaccinated. So for example, UK 56% vaccinated and Israel 59% fully vaccinated. In Israel, an additional data point to keep in mind is about 70% of adults are vaccinated, so not 100%. And overall, about half of the Israel's population is vaccinated, not all of it. So that's an important point, because sometimes we forget and we treat the countries as if they are fully vaccinated, all of them, and then every infection we say here there is a problem. This is Israel's worldometer. And if you see here, cases are rising. So we went from no cases to now 2,000 cases, for example. And so cases are rising. Some people who want to create some sensational impact, they talk in terms of folds. And of course, you can say from 0 to 2,000 would be infinity. From 2 to 2,000 will be, whatever, 1,000-fold and so on. So that can be done. However, I would also request you to keep an eye on the number of deaths. These are decoupled because of vaccination, because of herd immunity. Herd immunity includes vaccinated folks who were infected and recovered. And I would even put those youngsters who are more able to handle the virus properly. I'm putting them in herd immunity, which by definition is incorrect because they're really not immune, but they're still also not participant in a very lethal outcome of the virus. So here there is a decoupling, which you can see 2 deaths here. Again, 1 death is a lot as well. It could be me, it could be any one of our loved ones. So I am not minimizing this, but if you see here, compared to what we saw with these spikes, we are not seeing anything like that. So that is Israel. This is an interpretation of the study. The credit goes to David from Israel, who is here in San Jose. He sent me some of these links. And because the data is in Hebrew, I had to fall back on various articles. These links are, or the Salon is reputable or not, or left or right, I do not know. For me, it was more of a translating system. There is also another article that David shared, which I have also translated. This is the data that I'm going to talk about. This is Israel's health ministry, their report on, I think, in July. And this is the report. Some part of it is what I'm going to be discussing. This is, again, a link to the impact of vaccines in Israel. Then we'll talk about UK. UK also has, look at the number of cases, but a more important thing to keep in mind is that here on 17th July, cases were 54,000, and on 27th July, for example, the cases are 21,000, so more than 50% drop, and the question is why. And then here is an article that tries to answer that. And finally, the vaccine efficacy in UK. And it is interesting that the vaccine efficacy in UK is very different from the vaccine efficacy for the cases in Israel. My opinion is that the Israel's vaccine efficacy report, which is latest report, may need to be reviewed. It looks like an outlier. It looks like an incorrect data analysis. So with this, let's start our discussion. So first of all, vaccine efficacy reported by Israel Health Ministry. And how is that? Here is the slide. This is slide number 7 in that deck that I just showed you. And this is the vaccine efficacy. This is the number, this 39% is the number that is being used by people to come out and say, we are doomed. The variant has beaten the vaccine. So they have 4 categories over here. SARS-CoV-2 cases, and I believe cases versus symptomatic infection is that they may identify a case who may have done a follow-up. Again, because these things are in Hebrew, I do not know exactly the definition, but this is my hypothesis, and I may be wrong. The case may be that they were following up for something, and then a PCR test was done, and they were found to be positive. So for the positive cases, the vaccine fully vaccinated, 2 doses, efficacy is dropped. So this is the table I'm going to share very quickly over here. SARS-CoV-2 cases, 39% efficacy of both doses. Symptomatic COVID-19. So this is a vaccinated person, fully vaccinated person, then becoming symptomatic, and the efficacy is 40.5%. Unacceptable efficacy. Hospitalizations is still 88%. And severe COVID outcomes still 91.4%. Because of this, I want to show you another chart in that in this deck here, which would kind of explain why I think this data is not entirely accurate. Check this out. Here, these bars, January 21 is the blue bar, Feb is the orange bar, green is March, this dark yellow, April, and then purple is all fully vaccinated. So check this out. Start from the right side instead of the left. Here, severe COVID and vaccinated folks. Vaccine efficacy is 91%, severe COVID. Last month, it was 84%. The month before was 94%, then 91%, 86%. So not a lot of change in vaccine efficacy. It is kind of similar, bouncing up and down. So if you see here, vaccine effectiveness by outcome and month vaccinated with second dose. So this is since January, February, March, April, and now. So if you see this part, severe COVID, not a lot of difference. Then if you look at the hospitalization, a similar thing, 82%, 91%, 89%, 83%, 88%. Once again, not a lot of change. So hospitalization is also not affected. Then if you come down to these two categories, one is cases and the other one is symptomatic infection. And they have a definition of that, and I'll show it to you. Look at this. Let's look at this middle one, middle or third from the right and second to the left, the symptomatic COVID, 16%, 44%, 69%, 79%, and then a quick drop to 41%. And a similar behavior here with the infection, that from 75% to a drop to 39%. Now, an important thing to keep in mind is that this particular report, from the interpretation of those articles, again, I do not know how accurate the articles are, but I wish I knew how to read Hebrew. I do not. From the interpretation of the articles, they say that this particular data set is comparing vaccinated versus unvaccinated, but it's only hundreds of people compared, not thousands of or millions, as Israel has been doing, because they have a large swath of people who are vaccinated and they have a lot of data. So this sample data size is small as well. So to me, it seems like this is an outlier. They may need to review their data and update it later on. So with this, I'm not much worried about this. So if you see here, Israel is 59% fully vaccinated. Then efficacy dropped for the infections and symptomatic cases. Efficacy stayed the same or improved against hospitalization or severe COVID. Pfizer-BioNTech vaccine showed 95% efficacy during its trials. So during the trial, it was 95% for the infections and cases. So at this time, the efficacy is down to, let's say, 40%. Can we actually think about why this is happening? And I think we know the answer. The answer is very simple. Other than data anomalies, which may be a smaller sample size, which may be incorrect, or small size, data size does have a tendency for possible inaccuracies. But here, we also know that the variant, the Delta variant, is much more infectious. So it can enter a cell faster. So if you had, let's say, 3 variants standing here, Delta, and there were 3 Alpha variants, and you said, all right, guys, go. You are in a race and get into the cell. While Alpha would still be trying to get into the cell, Delta would have already entered the cell and infected it and started to replicate. Now, an important thing that I've mentioned before as well, the replication inside the cell is not any faster. So Alpha would take the same time, and Beta would take the same time, and Delta would take the same time. And it is just the entry into the cell that is fast. What does that mean? That means the affinity of the variant to the ACE2 has increased. And because of that, entry is faster, not the replication. But once they have entered, they have replicated, then they come out. once again, for the next cell, it will be faster for the delta to enter here. That means that if our immune system, from the natural infection or from the vaccine, if our immune system is actually able to handle the virus and the immune cells are kind of sleeping, or they are sitting in the bone marrow, they're sitting in the inflamed area, or areas where the inflammation had occurred, and they are memory cells, they would take 24 to 48 hours to wake up or to become fully activated and proliferated and functioning. During that time, this virus would have gone through a lot of cells, destroyed them, caused symptoms, and that is what would happen. Is that a virus escaping immune system or vaccine or natural infection? In a way, we can say yes. How we can say yes is virus has become faster. That is one way to kind of beat a vaccine or natural infection. Or instead of saying vaccine or natural infection, that is one way to beat the immune system. To say, I'm just going to be so fast that while you are wearing your shoes, I'm going to cause destruction. And not really escaping the vaccine is that point is that once the immune system is active, then the immune system is not failing. It's not that immune system says, you know what, virus, I can't do anything about you. That is why there is no severe cases or there is no hospitalization, because that takes a longer period of time. The damage to be done by the virus, it takes a longer period of time, and during that time, immune system has woken up, it has been working, and it would prevent that. So going back here, continuing with my notes that I gathered, Delta variant is known to be more infectious and contagious. We know that, and that is why it is doing what it is doing. This particular data from Israel seems to be an outlier. Vaccinated group is steadily increasing in size. So as the vaccinated group will continue to become more and more, or bigger and bigger, we will continue to see vaccinated folks becoming infected. Israel has an increase in cases while the deaths have not followed. This decoupling is important. And sure, we can wait. We can say, well, the cases are just rising now, and we should wait for a few weeks. I think that will be okay. This specific report did not compare large number of vaccinated and unvaccinated. So this specific report has been for a smaller number of people comparison. And I don't believe that they need a booster. This was when I said that both camps or many groups of people are trying to use this data for their advantage, Pfizer is in there as well, trying to put their own flavor in this. And they're saying, hey, we did a booster dose analysis. We did a test on that as well. And we have found out that even against the Delta variant, the booster dose is bringing efficacy to a very high level. So we recommend booster dose. And they are talking with Israel to say, let's do it. I think they tried that in the US, and the US said, no, not at the moment. And they are now trying with the Israel as well to say, why don't we allow a booster dose? At some point, they're going to end up getting a booster dose approved. My thinking is they would not be allowed with the booster dose in this state, because the booster dose is not anything changed in the vaccine. If the variant is changed, then, hey, the booster dose, what's the benefit? I understand that what they'll say is the following. They'll say, hey, this is your immune system. Here is a danger of Delta variant to arrive in a person's body. If we give them a booster dose, that would very quickly poke the immune system. And instead of virus poking it, our booster dose will poke this, and that would make the immune system alert again. It will wake it up. And now it is active and sitting and waiting and actively making antibodies. And because of that, as soon as Delta would come in, it would be effective. That would mean that every 3 to 6 months, they're going to say, let's have another booster dose because the immune system went back to sleeping and we want to wake it up again. That's, I don't believe in that yet. So continuing with our discussion, UK. So let's look at UK for a second. And before we go there, I also wanted to share, look at this cute, cute cat over here. Do you know who this is? This is Lotus. So this is Lotus and Barbara. This is Barbara's cat. And Let me show you one more. This is also Lotus. Barbara said that she's trying to be like her. Here is Lotus sitting on her castle, cat castle, and she is studying. Barbara said that when she's not studying with Dr. Bean, she is studying small animals and birds outside. So I love Lotus in this. I'm actually going to show you one more picture of Lotus that I loved a lot. But before that, check this out. This is another guest cat that we have in our backyard. Her name is Rondu. Rondu means whiner because when I think she got abandoned by someone. So about a month ago, she started coming into our backyard, and she would just whine all the time. She'll mew and she'll cry. So I started calling her a Rondu, a whiner. And can you imagine this, that we would feed her, and since we started feeding, I think since her hunger went away, she has never mewed again. This is another. Rondu thinks that she's so smart. When she looks at me, she just freezes there. She would not move a single muscle, and I think she thinks she's become invisible. And look at this. This is Lotus studying medicine with Dr. Bean. And this is Lotus, I think, relaxing after studying a lot of medicine, and now she's tired. And I think she was small at that time as well. So back here to the discussion, I want to make sure that Lotus is so funny. So now let's go to UK for a second. Look at this. Look at this new spike, the rise in cases, almost as big as the spikes before, although it did not reach there. But here is the interesting thing. It actually fell very quickly. Within last 10 days, it went from 54,000 cases down to 21,000 cases. And now what could be the reason? Is it the vaccines only? If it was just the vaccines, then this would not have happened. If the vaccines were already helping it, then why would the spike occur? So it is going to be more than the vaccine. It is going to be people's behavior. It is going to be herd immunity. It is going to be infected people who have recovered. It is going to be more younger people with better, handling of the virus, and they're not going to get tested and to say, hey, I have a problem. It may be something to do with the testing as well, and so on. They can be a lot. And if you look at the number of deaths, they are now, I would say that since the cases started to rise here, remember this was the time when we were saying, okay, 2,000 cases, and they are kind of still lingering there. So March, April timeframe is when the Delta arrived. And since then it has slowly then going up. So we have sufficient time to actually see if the deaths are following it and deaths are not following it. Yes, lately there was a big spike, and that may be that, again, I think it is behavioral. And then now the spike is going down. So I suspect that we would see, unfortunately, deaths for some more time because there was a spike. And so till we reach this point of spike, maybe another 3-4 weeks, and then we would see a ramp down of the deaths, unless this spike becomes another spike. Now, for UK, how is Delta variant and vaccines doing there? And once again, whenever I'm talking about vaccine, I would talk about the infected and recovered as well. They also have proper immunity. Even I think in some cases, studies have shown longer lasting than vaccine and even more robust than vaccine. And then there are some studies that said vaccine generated are more robust and so on. So that's just, I think they're equal. So here is a study. This study is funded by UK's health ministry. So if you see here, funded by Public Health England, and look at their finding first, then look at the data, because it could be the finding that also creates that confirmation bias. I hope there is no bias here, but they're saying this finding would support efforts to maximize vaccine uptake with 2 doses among vulnerable population. And remember, their adults are 70% vaccinated. So let's look at the data here for UK. And can we see the same issue? Let's say the vaccine efficacy drop in Israel. Look at this, same time frame, Delta variant, similar vaccines. 17th July, 54,000 cases. 27th July, yesterday, 21,000 cases. So more than 50% drop. So I'm using 50% here, but I'm showing you the absolute numbers too. Hospitalizations and deaths are still up. So this number is relatively up. It is still decoupled because it is not as high as it used to be with these spikes. However, unfortunately, this would continue on for some more days. And about 70% of the adults are fully vaccinated, 30% are not, and about half of so 56% are fully vaccinated, 56% of the overall population. So 46% or 44% are still not vaccinated. I would, once again, please realize my math is different from the way the math is done here. My math will then include infected and recovered in it. And then asymptomatic, those data points that we have seen that asymptomatically infected and recovered is a percentage of the overall population as well. Whatever that percentage is, some people say 5% and some say 10% and some 20%, that should be added to that as well. So UK's overall protected group is not 56% only. With this, we should add infected and recovered. With that, we should add asymptomatic as well. And with some being less accurate with the term, youngsters who do not have comorbidities, they can also be put in a group which is not very at risk, not highly at risk. Because the point of herd immunity are two. Number one, what kind of damage we're going to look at. And number two, what kind of spread we are looking at, or will the spread or R naught go down to 1? So here, let's look at the vaccine efficacy. This is Pfizer-BioNTech. It's the same Pfizer vaccine that we saw for Israel. The efficacy with 2 doses for cases and infection has gone down to 40%. Here, one dose, 30% against Delta, one dose, 48% against Alpha. This was original understanding. So not a lot of difference of one dose, and let's not even care for that at the moment. 2 doses against Delta, 88%, and against Alpha, which was original, 93%. So there is a drop, and that is almost from 94% to 88%, not a huge drop. So now think about this. Israel's data is showing 40% efficacy, dropping from 95% to 40%. And here the efficacy is dropping from 93.7 to 88. I still think that they need to look at the data once more. Now, AstraZeneca, 2 doses, Alpha was 74.5%, and with Delta it is 67%. So another 3 and for 7, about 6% drop. So that is what we have for UK. So what are my notes over there? UK's Office of National Stats expects 90% of the people to have antibodies. This is very important. Their department, their office for the statistics thinks that 90% of the people have antibodies. That's the herd immunity size. If that is true, then they're actually comfortable. They can now just look at this virus to say it is going to be common cold-like thing. Although we're not there, but that is the trend. Is it herd immunity that is helping? I think there is a contribution of the herd immunity. Is it people being more careful again? I think that is what I cannot say until I look at UK's population. So if you're from UK, please tell me, because I thought UK is fully open for at least next 2 months to kind of say, hey, look what can happen if you are vaccinated. Is it mobile apps that are alerting people to say, hey, you may have been exposed, or you are around someone who may be infected, and so on? Is it the counting or testing change in policy? Is the virus weaker? So this is my opinion that as I shouldn't call it weaker, as the virus becomes faster and faster, it has to become less lethal. Otherwise, it cannot continue on with the faster rampage. Or is there something else? So that is UK. So going to go back here. This is the discussion that I thought was important. Let me just look at a few questions here, and then so far I'm holding up fine. So I'm going to hang up and come back, and we'll discuss about the endothelial cells expressing spike protein, or could they express spike protein? The short answer is no, and I'm going to explain the mechanisms. So Pasi says, hey Pasi, how are you? Dr. Bean, holiday testing was done a lot, so many asymptomatic detected, and that scared the EU. Makes sense. So Judy says, vaccinated people are not testing for COVID when they get sick, just calling it out cold. That's fine. I'm just looking through the questions here. Question, if you have cytotoxic memory T cells in the vaccination, if you then get a booster, will those T cells think the cells with newly generated spike proteins are infected cells that should be destroyed? That is a function of the memory cells, that they would wake up and they would respond. But more importantly, so again, vaccine is a tiny amount, so they would respond and destroy or try to destroy a smaller number of cells. More importantly, they will start differentiating and proliferating. Proliferating means increasing in number. Differentiating means kind of becoming more specific and active. So if they become more specific, more active, more in number, that will increase their memory cells as well, and that would improve the immunity. Jody says somebody made a good point on Dr. C that testing may be more in Israel. Yeah, so there could be testing changes, there could be technology changes. There are mobile apps now. There are people who are actually now youngsters. Most of the older ones have gotten vaccinated or infected, or unfortunately not exposed to this anymore. So there are so many factors. This is a very good question, Samina. How many pregnant women are vaccinated in UK and Israel? I do not know. I don't have that data over here, and I'll have to look it up. I should always be careful to create that data point with you, for you. So I'll try to keep that from next time. Robert says, Dr. Bean, you spoke of innate arm and Toll-like receptors, 478 and ligands. Are those RNA ligands? They would pick up anything that they think is foreign, and there are different kind of pattern matching things. For them, it doesn't matter it is RNA or a protein. Many of them like to connect with proteins. Some of them can bind with the lipids as well. And I'm sure that there are some that would bind with RNA too, because RNAs or DNAs that are sitting outside are also picked up and digested. Jody, I saw your question. So Jody says, I guess my question is, without a vaccine, do we have less than 1% chance of not having severe COVID? I don't think so. And I think that's your point. And again, I hope that my discussion here is not to say pro or anti-vax. It's more of a data discussion. Carol says, Dr. Bean, my Bengal cat Raj says hello. Hello back to Raj as well. So Nick says, will the surge go into the winter in California? I have to actually look at the data in the US. The countries that I'm very impressed with is UK and Israel. They are so much clear on data collection and presenting. UK does have a lot of data, but mostly there is a spin on it that, so I have to look at that data and talk about it. Okay, so see one more question here. So Patricia says, I forgot to take my lufimectin Sunday. Should I take tonight or wait till next? No, take it. Again, I can't give an advice, but Luffy is welcome anytime. So yes, seeing a France Lorraine. Yes, so France is back. That is awesome. France actually changes the whole group's interaction. Thank you very much. Arun has a question. Is it right, Lancet, that nerve damage can predict long COVID? So, Arun, there are so many things. For example, today I was looking at another study that I wanted to discuss, and that was also courtesy of David from Israel. Like, David, I've started calling you David from Israel. I hope you don't mind. That's just my way of giving you credit that this is the David. He's actually here in San Jose, near me. The study was that SARS-CoV-2 infection reactivates EBV or Epstein-Barr virus or mono, and many of the long COVID symptoms are the symptoms of mono. So they then did a study to present that there is more than 50% of the people with the long haul actually have the activation of mono. So Arun, it could be mono reactivation, it could be the cellular damage that we discussed, it could be the nerve damage because of the cytokines or immune system activation that would cause attack on the nerve. It could be the monocytes becoming extra active and causing the blood-brain barrier and the other endothelial barriers to be congested and so on, or becoming permeable. So there seems to be multiple reasons. So Augie says, does prednisolone take down ranties? Prednisolone would bring down the whole inflammatory system, which includes ranties generating cells as well. So ranties is generated by many of the cells, including immune system cells. So when you suppress immune system or down, not suppress exactly, but when you reduce the activity of immune system and inflammation, then of course you are going to reduce production of ranties. This is why when I had started managing patients who were becoming long COVID with steroid, it works like magic. But let's say if somebody cannot have steroid, then and just very specific ranty blocker can be used too. Thank you very much. France is back. Yes, it's a good thing. And thank you, France. Okay, so Cindy says, I was negative for mono, had all long COVID symptoms. And Cindy, there are so many other reasons. The monocyte is one, and then mono, meaning Epstein-Barr virus, could be possible. Mast cell activation could be possible. Macrophage activation could be possible. We saw blood cell abnormalities. That could be possible. So it looks like there is a number of pathologies that can give rise to similar symptoms. And so that is what we see. And the example will be, let's say, if there is fire in the living room versus kitchen versus some other place, still there is going to be fire and smoke in the air. So inflammation or these symptoms that we see is kind of a final common pathway. What is really burning under the hood can be different. Doug is here. Hey, Doug, how are you? So we missed you. So tell me this. Colin is here. So before I answer, look at this question, tell me this. Would you like to hang up and then, instead of a chit chat, talk about endothelial cell and why they cannot express spike proteins? If you say yes, then I would do that as the next topic today. Colin says, is there a danger that symptoms will get mixed up with the end result being treated for the wrong thing, since so many symptoms are being attributed to COVID? That is true. And this is why, as we keep finding new pathologies, the medicine will keep becoming more and more precise. I still feel so fortunate that the I Recover protocol starts from, let's say, ivermectin and then fluvoxamine and steroids, and then goes to mast cell activation and looks at the macrophage activation. They are all step-by-step checked, and majority of the pathologies drop in these categories. So I am still amazed that I lucked out that when I put those things together, remember I had discussed it with you, the cool beans here, maybe 2 or 3 weeks before I actually handed it over to FLCCC. And we looked at all those various possibilities and the pathologies. So we just lucked out. And still, there has not been any pathology that is outside the bounds of the management techniques that are there. So $22.22, saw you after a long time, just had first jab, Moderna, congratulations. If I get COVID before I am fully vaccinated, can I take ivermectin? Yes. And not a straight advice to you, but I kept taking my ivermectin during the vaccination. Judy says, traveling to California, not vaccinated, not taking ivermectin advice. Judy, again, that's a risky thing. And the general advice, keeping vitamin D levels correct, keeping supplements correct, keeping your nutrition healthy, face mask, washing your hands, trying to be as careful as possible. Okay, so tell me, should we talk about that topic? Dr. Bean, did you ever discuss how ivermectin made more ACE2? I can't. No, I'm not aware of this, that ivermectin makes more ACE2. I would not think that there is a mechanism of making more ACE2. That does not look correct. Regenitarianism says, if you have cytotoxic memory T cells from the vaccination, if you then get a booster, so I answered that one a little bit before. Yeah, they would think that this is an infection and they would respond, but the point of vaccine is it is small. And that is the same thing. If the infection occurred, they would behave the same way. Okay, so sorry, I missed some folks' yes. So I'm going to hang up now. So my request to you, please like, subscribe, and share. And if you would like to support this work, if you like this work and want to support it, then there are 3 links in the description. If you want to use PayPal, you can use that. If you do not want to use PayPal, then you can use Buy Me a Coffee. And you can also become a patron as well. Thank you very much. I'll see you shortly again.